Liver cancer is cancer that begins in the cells of your liver. Your liver is a football-sized organ that sits in the upper right portion of your abdomen, beneath your diaphragm and above your stomach. The most common form of liver cancer is hepatocellular carcinoma, which begins in the MER type of liver cell, hepatocyte. Other types of cells in the liver can develop cancer, but these are much less common. Not all cancers that affect the liver are considered liver cancer. Cancer that begins in another area of the body, such as the colon, lung or breast, and then spreads to the liver is called metastatic cancer rather than liver cancer. And this type of cancer is named after the organ in which it began, such as metastatic colon cancer to describe cancer that begins in the colon and spreads to the liver. Symptoms. Most people don't have signs and symptoms in the early stages of primary liver cancer. When signs and symptoms do appear, they may include losing weight without trying, loss of appetite, upper abdominal pain, nausea and vomiting, general weakness and fatigue, abdominal swelling, yellow discoloration of your skin and the whites of your eyes, jaundice, white, chalky stools. Causes. It's not clear what causes most cases of liver cancer, but in some cases the cause is known. For instance, chronic infection with certain hepatitis viruses can cause liver cancer. Liver cancer occurs when liver cells develop changes, mutations in their DNA, the material that provides instructions for every chemical process in your body. DNA mutations cause changes in these instructions. One result is that cells may begin to grow out of control and eventually form a tumor, a mass of cancerous cells. Risk factors. Factors that increase the risk of primary liver cancer include chronic infection with HBV or HCV, chronic infection with hepatitis B virus HBV or hepatitis C virus HCV increases your risk of liver cancer. Cirrhosis. This progressive and irreversible condition causes scar tissue to form in your liver and increases your chances of developing liver cancer. Certain inherited liver diseases. Liver diseases that can increase the risk of liver cancer include hemochromatosis and Wilson's disease. Diabetes. People with this blood sugar disorder have a greater risk of liver cancer than do people who don't have diabetes. Non-alcoholic fatty liver disease. An accumulation of fat in the liver increases the risk of liver cancer. Exposure to aflatoxins. Aflatoxins are poisons produced by molds that grow on crops that are stored poorly. Crops such as corn and peanuts can become contaminated with aflatoxins, which can end up in foods made of these products. In the United States, safety regulations limit aflatoxin contamination. Aflatoxin contamination is more common in certain parts of Africa and Asia. Excessive alcohol consumption. Consuming more than a moderate amount of alcohol daily over many years can lead to irreversible liver damage and increase your risk of liver cancer. Obesity. Having an unhealthy body mass index increases the risk of liver cancer. Tests and diagnosis. Diagnosing liver cancer. Tests and procedures used to diagnose liver cancer include blood tests. Blood tests may reveal liver function abnormalities. Imaging tests. Your doctor may recommend imaging tests such as an ultrasound, computerized tomography (CT) scan and magnetic resonance imaging (MRI). Removing a sample of liver tissue for testing. During a liver biopsy, a sample of tissue is removed from your liver and examined under a microscope. Your doctor may insert a thin needle through your skin and into your liver to obtain a tissue sample. Liver biopsy carries a risk of bleeding, bruising and infection. Determining the extent of the liver cancer. Once liver cancer is diagnosed, your doctor will work to determine the extent stage of the cancer. Staging tests help determine the size and location of cancer and whether it has spread. Imaging tests used to stage liver cancer include CT, MRI and bone scan. Treatments and drugs. Treatments for primary liver cancer depend on the extent stage of the disease as well as your age, overall health and personal preferences. Liver cancer treatment options may include Surgery to remove a portion of the liver. In certain situations, your doctor may recommend partial hepatectomy to remove the liver cancer and a small portion of healthy tissue that surrounds it if your tumor is small and your liver function as good. Liver transplant surgery. During liver transplant surgery, your diseased liver is removed and replaced with a healthy liver from a donor. Liver transplant surgery is only an option for a small percentage of people with early-stage liver cancer. Freezing cancer cells. Cryoablation uses extreme cold to destroy cancer cells. During the procedure, your doctor places an instrument cryoprobe containing liquid nitrogen directly onto liver tumors. Ultrasound images are used to guide the cryoprobe and monitor the freezing of the cells. Heating cancer cells. In a procedure called radiofrequency ablation, electric current is used to heat and destroy cancer cells. Using an ultrasound or CT scan as a guide, your surgeon inserts one or more thin needles into small incisions in your abdomen. When the needles reach the tumor, they're heated with an electric current, destroying the cancer cells. Injecting alcohol into the tumor. During alcohol injection, pure alcohol is injected directly into tumors, either through the skin or during an operation. Alcohol causes the tumor cells to die. Injecting chemotherapy drugs into the liver. Chemoembolization is a type of chemotherapy treatment that supplies strong anti-cancer drugs directly to the liver. During the procedure, chemotherapy drugs are injected into the hepatic artery, the artery from which liver cancers derive their blood supply, and then the artery is blocked. This serves to cut blood flow to the cancer cells and to deliver chemotherapy drugs to the cancer cells. Radiation therapy. This treatment uses high-powered energy beams to destroy cancer cells and shrink tumors. During radiation therapy treatment, you lie on a table and a machine directs the energy beams at a precise point on your body. Radiation therapy for liver cancer may involve a technique called stereotactic radiosurgery that simultaneously focuses many beams of radiation at one point in the body. Targeted drug therapy. Targeted drugs work by interfering with a tumor's ability to generate new blood vessels. They have been shown to slow or stop advanced hepatocellular carcinoma from progressing for a few months longer than with no treatment. More studies are needed to understand how targeted therapies, such as the drug sorafenib nexavar, may be used to control advanced liver cancer. Lifestyle and home remedies. Reduce your risk of cirrhosis. Cirrhosis is scarring of the liver, and it increases the risk of liver cancer. You can reduce your risk of cirrhosis if you drink alcohol in moderation, if at all. If you choose to drink alcohol, limit the amount you drink. For women, this means no more than 1 drink a day. For men, this means no more than 2 drinks a day. Maintain a healthy weight. If your current weight is healthy, work to maintain it by choosing a healthy diet and exercising most days of the week. If you need to lose weight, reduce the number of calories you eat each day and increase the amount of exercise you do. Aim to lose weight slowly 1 or 2 pounds (0.5 to 1 kilograms) each week. Use caution with chemicals. Follow instructions on chemicals you use at home or at work. Get vaccinated against hepatitis B. You can reduce your risk of hepatitis B by receiving the hepatitis B vaccine, which provides more than 90% protection for both adults and children. The vaccine can be given to almost anyone, including infants, older adults, and those with compromised immune systems. Take measures to prevent hepatitis C. No vaccine for hepatitis C exists, but you can reduce your risk of infection. Know the health status of any sexual partner. Don't engage in unprotected sex unless you're certain your partner isn't infected with HBV, HCV, or any other sexually transmitted infection. If you don't know the health status of your partner, use a condom every time you have sexual intercourse. Don't use intravenous, IV, drugs, but if you do, use a clean needle. Reduce your risk of HCV by not injecting illegal drugs. But if that isn't an option for you, make sure any needle you use is sterile and don't share it. Contaminated drug paraphernalia is a common cause of hepatitis C infection. Take advantage of needle exchange programs in your community and consider seeking help for your drug use. Seek safe, clean shops when getting a piercing or tattoo. Needles that may not be properly sterilized can spread the hepatitis C virus. Before getting a piercing or tattoo, check out the shops in your area and ask staff members about their safety practices. If employees at a shop refuse to answer your questions or don't take your questions seriously, take that as a sign that the facility isn't right for you.